possible. And so therefore, the
Hello, Dr. Arpita.
Yes, ma'am. I think sir is sir.
Is there
Sir,
any issue with the network?
no, ma'am. I don't think so. But I'll just connect with sir, ma'am.
Yeah. Message him or call him.
Yes. I'll just do that.
Huh?
Hello, Dr. Palip, sir.
Arpita, just give him a call.
Ma'am, sir is here already.
Okay.
I think there was some issue. So since sir
there was
came
some
to
issue. Yeah, there was some
yes,
issue.
yes. I'm sorry.
Now
sir.
it's sorted
Now,
out.
right now we can. Right now we
Yeah.
can.
You can, no? Yeah.
Yes.
So I need to again share the screen. One moment. I need to share the screen.
Yes.
The screen. What is happening? Your client has been subscribed. What is this? Now. Yeah. So I used to get the problem of understanding these two languages. The opportunity I got was to teach at Podar and teach at simultaneously at Grand Medical College. Now, it was so easy for me to teach. Can you hear me now? Is it all right?
Yes.
Yes, sir,
Yes,
you're
sir.
audible.
It's all right. Continue, please.
Yeah. So when I used to teach at Grand Medical College, it was so easy. When I say conception has occurred, means a egg is fertilized by the sperm. But when it came to teaching at Podar, the problem was quite different. Shukra Shonita is not enough. Shukra Shonita and Atma Sanyoga. Now that used to be a problem. Unless I understood what is Atma, and understanding Atma was quite a problem to explain actually what it means. So this is how I had to decipher. When you say that Vata, Pitta, Kapha, what are they really? And I think most of you, I'm not sure whether you all understood really what they are and how to identify them. The Vata, Pitta, Kapha are physical in nature. They are material things. Panchama Bhautik. Panchama Bhuta are material. So non-material Sattvara and material Vata, Pitta, Kapha, the combination was most important to understand. That took me years to understand that. And that's the reason why I wrote this book, Dosha Dhatu Malavigyan. That's the basic of Ayurveda, the physiology. So anyway, we're coming to endometriosis. Now, what is the nearest thing to endometriosis pathology? I found Udavarta Yoni, which is described in Ayurveda, fits into endometriosis. Vegas avartanado jonim udavartayate anilaha sa rugartaha rajaha kruchrena udavartam vimuchyate artave sa vimuktetu dakshinam labate sukham rajaso gamanat urdhvam yeyo udavartini. Now, how do we really see the whole thing? Now, the pathology which is been suggested is said in this, the etiology is basically Vayu's reverse pathway. The traveling of Vayu in a reverse pathway led to retrograde menstruation, and this caused the painful menstruation. And once the menstrual flow is established, the pain and discomfort get relieved. And this condition is called Udavarta Yoni. That's exactly what it is. And description compares well with spasmodic dysmenorrhea and also endometriotic dysmenorrhea. The way that endometriosis pathophysiology we are going to talk. Now that's how I feel that Udavarta Yoni with disturbed apana vayu, with reverse peristalsis in the smooth muscle of the uterus, causing retrograde menstruation and deposition of this endometrium into the peritoneal cavity leads to the endometriosis. So Udavarta Yoni is how we describe endometriosis. Endometriosis is defined as the presence of ectopic endometrial-like tissues outside the uterine cavity. Because when you say endometrium, means it's inside the uterine cavity. So it's like endometrial tissue that responds to cyclic or hormonal stimulation. And it invades the surrounding tissues. It's a benign proliferative growth. So ovaries, fallopian tubes, peritoneal surfaces, Caesarean scar, myometrium, bowel, bladder, pleura, nose, as far as distant places are affected with endometriosis. Now, what is the problem with this? Why these things happen? So this endometriosis, according to modern understanding, triggers a chronic inflammatory reaction, and this results into adhesions, and this also causes pain. Pain due to the reason because whenever there is a hormonal stimulation is there and hormonal withdrawal is there, there's bleeding occurring locally, and that continues to cause swelling and pain, and this leads to inflammatory reaction, and then the whole thing, adhesions, scars, so things happen, and complete distortion of anatomy of the pelvic structures can happen because of that. And we'll see that more types of endometriosis ahead. So fluctuating hormonal levels affect this activity levels to that extent that woman completely becomes, lifestyle becomes difficult, may not be able to do her normal activities. But there are many cases, the complaints vary. So the amount of disease which we see and symptoms may not correlate many times also. That's also sometimes happens. Now, nearly 2 to 10% of women suffer with this from the general population. And nearly 30 to 50% of the infertile women will have probably endometriosis. You can understand how serious this problem with infertility. And after this experience of pain is not just premenstrual and intramenstrual and postmenstrual, but most of the cycle this woman is suffering. You know, the mother-in-law is most affected person because this woman doesn't produce children, number one, and she's always in pain, and she's no good to be of any help in home. So therefore, it creates a lot of family problems also. We have seen number of such patients where the mother-in-law is exasperated. She thinks that this woman is malingering. In fact, this girl is suffering from the pain, but there is many times people think they are malingering. So quality of life significantly reduced. Normal activities are restrained. The pain, discomfort, anxiety, and depression also. There's a large amount of depression in these patients. So some because of this changes in the hormonal patterns, consequently symptoms are worse at certain times and less at certain times. So during the whole menstrual period also, people experience severe pain. There is a pelvic pain constant. And in rare instances, cyclic pains occur at distant places, like in the upper part of the chest, ribs. There can be some pleurisy-like pain. There can be scars, becomes tender, painful. So many such things can happen in the endometriosis. Now, to summarize the various symptoms, dysmenorrhea, non-menstrual pelvic pain, dyspareunia, dysuria, dyschezia, fatigue, hematuria, shoulder tip pain, cyclical pneumothorax, hemoptysis, chest pain, cyclical square swelling, especially post-cesarean section. And some of the endometrium can get, displaced and can be affecting scars. And you do get certain patients having this scar being affected cyclically, and the pain. So infertility, of course, is the most prominent symptom, and there may be any other unexplained cyclical symptoms also. So let us come to the etiopathology. Just as Ayurveda has described, even modern medicine describes the same pathology, that is retrograde menstruation, implanted endometrial tissues in the pelvis. But isn't it surprising? There's a lot of immune cells in the peritoneum. And these immune reactions should destroy these implants. Normally, these are foreign bodies. They're not supposed to be there in that area. So what happens? But it does not happen. And how do you say that there is chronic inflammation? Because the number of cytokines, inflammatory like COX-2 or interleukin-6, VEGF, UPA, all these are present in the peritoneal fluid and endothelial cells. So therefore, inflammation is the most important thing which is happening because of this. And why does it happen? There's a new concept. Why does it happen? Why does the immunity gets affected? It's very interesting, the new concepts. And the new concept is something about enteric microbiome, the gut microbiome. There's altered gut microbiome where certain gut microbiota, they weaken the intestinal barrier and they cause the leakage of activated neutrophils into peritoneum, leading to inflammatory state. So that's one theory which has come up now. And what is interesting is that gut microbiota, we may think that, microbes are there in the gut, they are different. But these are the same microbiota, can be seen in the vagina, can be seen in your salivary secretions. So today, to identify gut microbiota, we just have to do the salivary fluid, just take it for testing, and we can find out which type of the gut microbiota are there of a particular person. So what has been found, in case of endometriosis, there is abundance of firmicutes and there is decreased bacteroides and Rhinococcus phyla in the